A new study suggests coronavirus antibodies decline rapidly and immunity among the population could be waning. Scientists at Imperial College in London tracked antibody levels in 365,000 randomly selected adults. Professor Karol Sikora is the Dean of Medicine at the University of Birmingham. He says there's much more to the body's immune system than just antibodies.
It means that the antibody response, that's our primary immune rejection of a foreign protein, in this case the virus, wanes a bit. Now, we've known that since the beginning, and indeed every week Public Health England have published a survey of antibody levels in various communities. They come to a maximum 6 weeks after infection, and then they fall. But the other immune mechanisms kick in, including T-cell immunity, lymphocytes, white blood cells that target the virus, and various other things we understand even less well than T cells. So we don't really know what it means. It's a sort of negativity in the newspapers. It's billed as though it's terribly negative. It may not be. And what really matters is, over a period of time, do we as a society build up immunity against the virus?
Would it mean, for example, that we have to continue vaccinating against coronavirus, even if we've had one round of vaccination for coronavirus?
It depends very much what the critical factors are that make the vaccine work. If it is only on antibodies, and we know the vaccines, all the main vaccines that have been tried have been looked for antibody production, and they do make antibodies. If that was the only mechanism, this would be worrying. But almost certainly the same vaccines also stimulate T cells, so it'll be a combination. We won't know whether these vaccines are actually working in reality for some time. We know they stimulate the immune response. Very clear-cut data from Oxford, from Imperial, from the United States. What we don't know is how protective they are out there in the wild, where the virus is there. Do they actually protect the patient sufficiently?
Oxford University's coronavirus vaccine is said to trigger a robust immune response in both young and older adults. Is it time for optimism?
I think so. This is really encouraging. When they say that, they mean the antibody levels that were up, albeit temporarily, and the T-cell activity was also up. That data has been published by Oxford and some of the other vaccine makers. This is really good news. However, at the end of the day, we've got to get society up to a level of immunity, either by being infected by the virus or by being vaccinated to prevent them being infected. These are the only two ways we can get an immune population, and therefore the virus will have nowhere to run to and will eventually disappear, and the pandemic will be over. And the most encouraging thing so far is, at least in the UK, the number of admissions per 24 hours into hospital seems to be plateauing, which, you know, it's not great for those being admitted, but it's wonderful that we seem to be reaching the top of what everyone's calling the second wave.